Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director. Today is Thursday, April 1st, giving you the update from Albany Med. All right, Fred, let's jump into the numbers. First graph, Capital Region, people in the hospital diagnosed with COVID. We're at 101. That's down slightly. I think we were 110 earlier in the week. Still about in that same range, and we're watching it very closely.
Since March 5th, Dennis, we've been hovering.
Okay, very good. Next graph, admissions and discharges here to the medical center. Now, what's interesting on this, Fred, is if you look very carefully, as we talked about this earlier in the week, the number coming in and the number going out are roughly matched.
That's right.
The actual number coming in is smaller than it has been in the past. But some good news there, if you look below the graph, those individuals who unfortunately had died as a result of COVID, we're seeing a significant drop off there. We've really only had, I think, one in the last almost 2 weeks here on this campus.
That's right, Dennis. They're being discharged as opposed to dying. That's obviously much better.
For sure. And then if we look at the morning census here at the medical center, our current number is 30. We have 20 on the floors, 10 in the ICU, 6 on ventilators. And Fred, same information as before, a certain percentage of those no longer infectious.
I think this morning it was 5, Dennis,
5
out of the 30.
Okay, very
That's
good.
Right.
So if we look at the last 7 days, Fred, just some data here. Last 7 days, we've had 22 come in and 25 go out. So over the last 7 days, a net drop on this campus of 3.
That's right.
Okay, very good. Fred, let's talk about vaccine numbers here. Capital Region, as of this morning, 390,000 have received their first dose.
That's amazing.
We're both wearing buttons here to say, don't hesitate, vaccinate. Right? A couple things happening all at the same time. We have a lot of vaccine coming into the Capital Region. I think we heard earlier in the week almost 60,000 doses just this week alone. Eligibility criteria dropping, so 30-year-olds and above. And next week
that changes.
16.
16.
Right. And a campaign, really, to encourage people to get out and get vaccinated. So once again, we encourage you to go out to capitalregionvax.org. An easy way there to find out, number one, are you eligible? Second of all, where you can get vaccinated. And there's even a great option on there, Fred, to pre-register. So you can put your information in, and then individuals would potentially either email you or call you and tell you when your appointment is.
You know, Dennis, the campaign that started in the past couple of days is just tremendous. I saw the commercial last night for the first time.
Right.
You know, a number of leaders from our community talking about getting vaccinated, yourself included.
Myself included.
Really powerful stuff.
Great message out there. A lot of community voices, and we're very proud of it. So, Fred, let's talk a little bit more about vaccine. In the news, many of us have heard something related to Johnson & Johnson and a batch, if you would, that was not appropriate for use on patients.
That's right, Dennis. So it was reported today, there's a new manufacturing site in Maryland.
Okay.
So it hadn't actually distributed any vaccine yet. And there's some mix-up in how the vaccine was created.
Okay.
So the quality control was such that they're not going to release those vaccines. So it's important to understand that if you've received Johnson & Johnson, or if you show up to get vaccinated and they have Johnson & Johnson to give you, that's all safe. The vaccine that had a problem was never released to the public.
That's a great and important message. So anything that's come out already went through quality control, and we know it's safe, and anything that comes out in the future as well. All right.
And there's other news in the vaccine front. Pfizer, this is really good news. So Pfizer has continued to track those individuals in their phase 3 trial. They now have 6-month data. And at 6 months, the vaccine is still 91% effective in preventing COVID. So they're going to be submitting that data to the FDA probably later this month, and we'll get full authorization for the Pfizer vaccine.
Which is great. And as you said earlier when we were walking up here, there's no reason to think that the vaccines that have been used so far won't act in the same way as other vaccines and give you that type of immunity.
That's right.
Fred, we were in a meeting yesterday, and I think all of a sudden we both got a news alert that there's some exciting news out there as far as whether or not the vaccine will be effective and safe even down to the age of 12.
That's right. So Pfizer has been working on that population, the 12 to 15-year-old population, and they now have data that suggests it's 100% effective in that population. So that'll be submitted to the FDA, and approval will come. I think in time for the beginning of school season.
So would you predict that it's more likely than not that by the summer or early fall we'll be using a vaccine or more than one vaccine down to the age of 12?
I think that's very likely, Dennis. I think it will move along that quickly.
That's exciting news.
It
All right,
is.
great. All right, so pay attention to the campaign. If you're eligible to get vaccinated, please register and go ahead and get your safe and effective vaccine. Fred, on Thursdays, we've committed to updating our workforce on length of stay, all the important reasons we do that, efficiency, flow in the hospital, quality. How's it going?
So let's pop up the graphic. You can see here that the total length of stay, the dotted line, continues its downward trek. So that's good. As more of our long stay COVID patients are discharged, that number's coming down. And we're in the 5.7 range for the non-COVID population. We'd like to see that number continue to come down as well. But Dennis, there are a number of factors that are outside of our control.
Yes.
Transport of people out, nursing homes accepting them, et cetera. But we're working on those issues.
Whole group of people working on it all the time.
Absolutely. It's important for people to move quickly to the next stage of their care, whether that's home care or a SNF or
Yes.
a rehab facility. So we're working hard on that.
All right, very good. In the same vein as length of stay, operational things, we'll put this one in the category of things that occurred more with COVID and are now going to carry forward. Telemedicine. Telemedicine, for those that may not be familiar with, is an opportunity for a patient to receive a medical evaluation remotely, most often at home, with a provider. And many hospitals and physician practices adopted this pretty aggressively in the beginning of COVID. And we think some of this is durable, and we think some of these practices we're going to continue going forward.
Absolutely. So there was a great article in the Wall Street Journal
Yes.
on Monday talking about telemedicine with lots of examples around the country, and it pointed out a few very interesting facts, Dennis. So at the peak of the epidemic last year, fully a third of Medicare patients had a telemedicine visit.
That's incredible.
Isn't that amazing? The acceptance of virtual visits
Right.
has been extraordinarily high, and actually a couple of medical students here and one
Yes.
of our faculty are publishing something in
Yes.
regards to that. And there are a couple of areas where it's particularly effective, and I must say I wouldn't have predicted this. One of them is psychiatry.
Right.
But I guess if the ease with which you can interact with your psychiatrist or psychologist is such that you're more likely to do that, it kind of makes sense that it would be embraced by those folks with depression and other forms of
Yep.
mental illness.
And appointments filled actually went up as a result of that.
Appointments filled, people actually showing up and
Right.
not canceling or no showing. Yeah, it's remarkable how effective it's been in that population.
So the medical center, many of the specialties in the practice, many offerings, including in our emergent care settings for telemedicine visits, and we encourage you to explore those if that's right for you.
And it's going to be growing in the practice.
Very good. Fred, for those who came in to work early this morning or perhaps left last night, they would see that the pillars were lit up both blue and green. I think this is one of the exciting things that we do with the pillars now is we will light them up with various colors to recognize various things. Why did we light them up blue and green?
So Dennis, it's National Donate Life Month.
Yes.
So this is a push to sign up, be a donor, and God forbid something happens, contribute something of yourself to others.
Now, our local Donate Life organization is the Center for Donation and Transplant. They cover a very large area. They work closely with many different clinical services and non-clinical services here in the hospital to make sure that that gift of life is honored when it's appropriate to do so. And Fred, they recently published some data about the 2020 experience, and honestly, the numbers are pretty remarkable.
They are. So this is our community, Dennis,
Right.
Capital Region. So there were 78 organ donors
Right.
that improved or saved 195 lives
Incredible.
as a result of that. There were 481 tissue donors,
Right.
which enhanced the lives of 36,000 people. Just remarkable how many people were touched by that.
It's remarkable work. It's often tough to do,
Yes.
but it's very important that it be done, and we thank our staff for doing that, and we thank the Partnership for CDT. In New York State, Fred, 43% of all adults are registered as organ donors, and I think the number nationally is actually incredible.
I think it's 165 million, Dennis.
So this month, as we look at the Donate a Life Month, look for more information on the internet, look for ways in which you can get involved, and if you're not an organ donor, that's something that you might want to consider doing as well.
There's one more group to thank, Dennis, and that's family and friends of donors.
No question about it. They make the ultimate gift.
They do.
Okay, that'll wrap it up for this week. Now, Fred, I'm not here next week, but you're going to have some guests in here.
That's right. On Tuesday, we're going to have the Dean,
Oh, excellent.
Dr. Vincent Verdile. And on Thursday, tentatively, our new CNO,
Great.
Lisa Masserway, will be joining us.
Well, we look forward to seeing both of those.
Yes.
All right, have a great time. All right, to those that are working here this weekend, as always, we thank you for the efforts you put in to make sure we're providing care 24/7. Fred will be here next week. I'll see you when I get back. We ask that you once again, please take care of yourself, take care of each other, and Fred, we'll see you next week.